Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the important anatomical aspects of the lens? Right. In the anatomy of the lens, mainly the lens is a biconvex surface and the lens is a biconvex surface, something like this, and it has a diameter of 9 to 10 millimeters diameter. It has a diameter of 9 to 10, refractory index of 1.39, and the total power is 16 to 17 diopters. So it has a diameter of the 9 to 10 millimeters and refractory index of 1.39, and total power is 16 to 17 diopters. Then it has two surfaces. So we have two surfaces in the lens. One, we have anterior surface, second we have posterior surface. Anterior surface has radius of curvature of 10 millimeters, whereas posterior surface has radius of curvature of 6 millimeters. So one surface is actually an anterior surface with radius of curvature of 10 millimeters, whereas there is also a posterior surface with radius of curvature of 6 millimeters is present in the posterior surface. Then, so thus you can say that the posterior surface is actually more curved and more steeper than the anterior surface. So it is something like this: anterior surface, posterior surface is more curved and steeper than the anterior surface. So
thank you and thank you for watching.